Good night, or good morning rather. Yours truly, Professor Dr. Dolphy Gilpin here, the legislator, Decatur, Georgia. And we continue with abnormality, malignancies in the body. And tonight we are on obstetric and gynecology focus. And in specific, we have here the fallopian tube, the uterine canal, the vagina. Let me just point it here with this ophthalmoscope, vagina, that fallopian tube, uterus, ovaries, and so on. That's the anatomy. Physiology, also briefly. But we are on endometrial carcinoma or endometriosis. And what happens here is that we use an analysis called a pap smear, and we take a smear on some glass and we put it under the microscope, and if it comes back positive for that, if it returns a positive, then we can safely assume that we have some STDs or whatever the case of the malignancy is. Wherever in the case of endometrial carcinoma or endometriosis, what happens is that blood clots are found all over the obstetric and gynecology column. Okay, it's found, it comes up even to the armpit at times, these blood clots. Even sometimes found in the neck, but mostly the vaginal canal, the uterus and fallopian tube area, these blood clots are formed. And it ranges from benign to moderate to very severe malignancies, and if found, it must be treated. A positive is returned for endometriosis or endometrial carcinoma. So I will not go over the method for solution for this endometriosis, but what I'll do, some of the medications used for some of the STDs, associated STDs and blood clots and hormonal treatment and whatsoever. I've had the structure of them drawn on these IPCs. Yeah, the structure of the solution, so that normally, about 4 years ago when I did the same endometrial carcinoma / endometriosis upstairs, I did it when the electronic periodic table or electronic drug synthesis was not done. So today we have the solutions for all these obstetric and gynecology problems on slides. And that's as far as I go. I won't be doing any treatments with respect to prescription and so on. The solutions are found on these IPC slides, which are other solutions in medicine for hematology, pathology, cardiology, ophthalmology, epidemiology, you name it. All those medical fields, we have solutions for them, drug solution on these IPCs. So tonight, yeah, endometrial carcinoma, which is like a cancer. Some people term it like vaginal cancer. And here is the diagram. Just show a magnified view before we finish. Just a magnified view. The vagina uterus, cervix, ovary, and fallopian tube. And the blood clots are all over this fallopian tube, uterus, vaginal cavity, cervix. I use pap smear also to detect some STDs. Associated STDs, yeah. So there you have it. Endometrial carcinoma, anatomy, physiology, pathology, and even medical detection.